Good afternoon. Thanks for joining today. This is Rebecca Morley with the National Center for Healthy Housing. I'd like to wish everyone a happy Childhood Lead Poisoning Prevention Week and acknowledge that there's a lot of activity going on out in the field. One of the registration questions was, what are you doing to celebrate National Childhood Lead Poisoning Prevention Week? And we got lots of responses. People are doing training, people are doing education of child care providers, healthcare providers, families, holding fairs, working on PSAs. So it's really extraordinary to see so much activity and energy, and I just want to thank all of you for that. So just some background information about this webinar. Everyone is in mute mode right now. We're expecting upwards of 80 participants, and so it's just too difficult to have everyone participate through the audio with that number. So we're using the webinar function, and you can feel free to send chat messages to me or send a question for our panelists, and we'll pause and take your questions as we go. I'm also going to ask Jane Malone, who's our policy director, to kind of monitor the questions if she can as well, and flag for me if there's any ones that we're missing. So with that, why don't we just start? I want to welcome you, and I want to start with a quick update on where we are with the CDC Restoration Campaign, which has been a high priority for the National Center for Healthy Housing and for the National Safe and Healthy Housing Coalition. After that, you'll hear about some local and state innovations. Specifically, we'll hear from John Belt, Tom Carroll, Delilah Cardona, and also during my presentation, I'm going to ask Mark Podolski from Cornerstone Government Affairs to provide a little bit additional detail about where our lobbying efforts are coming to fruition and hopefully paying off in the very near term. So with that, let me just advance my slides. So this is the old news. I think everyone at this point is aware that the CDC program was cut from $29 million in FY11 to $2 million in FY12. In FY13, the President's budget did not provide a specific number for the lead program, but once again had combined it with the asthma program for a total of about $27 million. The FY13 budget has not come to completion yet. The Senate published a number of $10 million, which obviously is 5 times what we had in the prior year. The House budget was never published, the subcommittee budget, and they haven't completed their work. And Mark will say more in a few minutes about where we are with that FY13 bill. And I'm sure he can say a few words about FY14 as well. Here's what we know based on a survey of state programs about the program impacts of this cut from $29 to $2 million. We estimate that about 345 positions will be lost nationwide. The program elements most severely impacted include the education and outreach components, surveillance, evaluation, and the direct services, which are typically your environmental health services, the inspections that are conducted in the homes of kids with elevated blood levels. The largest staff reductions that were reported through the survey were in epidemiology and data management. In terms of surveillance, about 20 programs have adopted the new health system. 13 say that because of the budget cuts they will not be able to adopt the system, and 9 others may rethink their decision to adopt it. So as you know, at the beginning of this year, we adopted 2 main advocacy goals. One was to backfill the 2012 budget so that the program could continue, and we were hoping for a reallocation of some funding within HHS. Our target was about $16 million. Our second goal was to restore the budget in 2013. Now, as you'll hear later, because of the extended budget cycle, we are still completing FY13 at a point when we would normally have already been completed. We're under continuing resolution. Here are the strategies that we had identified as being the most high impact for achieving our goals. One was to engage the big city mayors. Another was to engage other key interest groups. A third was to use the media. And this was all focused on really encouraging the White House and the HHS leadership to fix 2012. Second we wanted to ensure that our congressional members knew about the importance of this program and restored it in fiscal year 2013. And we were doing this primarily through grassroots advocacy and through our professional lobbying activities. This has not been a lift that the National Center has done on its own. We've had many partners that have helped us. This particular resolution, which passed in June, was spearheaded by the Coalition to End Childhood Lead Poisoning, so we're really grateful for their leadership as well. Also, the Lead and Environmental Hazards Association spearheaded this declaration at its annual conference, and hundreds of delegates signed on to this declaration, which was sent to high-level leaders at the agencies, on the Hill, etc. Again, congratulations to Steve Weil and all the members of LEHA for pulling this together. At the local level, we've been blessed to have the Childhood Lead Action Project spearheading work that has had national impact. They led a petition to President Obama, over 1,000 signatures. They've also held a regional meeting which spurred a lot of attention among regional HHS people, which we believe has had a very positive impact on where we sit today. We've pushed hard to get the media to understand the importance of this program and the impact of the cuts. I think that media have found it interesting that there has been this cut to the program at the same time that CDC has revisited the reference value or the level of concern. So we've had good success in getting the media to be interested in this issue. Speaking of the reference value, I just wanted to show you that there is a table, the link at the bottom will take you to it, that shows a state-by-state breakdown of the kids with blood lead levels over 10 and also between 5 and 9. I happen to pull out Pennsylvania here just so you can see the sizable increase in the caseload of children that need services as a result of the reference value policy decision. Across the board, we're hearing it's about a 6 to 7-fold increase at each state level. Today, we just finished and are announcing this new fact sheet that's for parents. It's to help them understand what their blood lead level results mean. This has been actually very personally interesting to me. I just had my child's blood lead tested last week. It's interesting to see what physicians know or don't know about the reference value. And we're hoping to get this in the hands of pediatricians so that they can provide this to parents to help them understand what do the results mean, and then how do they make a plan to address their child's blood lead level. So the second page of this document is about making a plan and addressing the environmental sources of exposure. I mentioned that our lobbying effort, we began in earnest in February of last year with an advocacy day. Here's the music family, Sean, a young boy who he himself was impacted by lead as a young child, his mother, Brenda, who's a parent activist, and then Senator Harkin, who's the chairman of the Labor HHS subcommittee that handles CDC's appropriations. Also here is Mike Trudeau, who is with the health department that responded to Sean's blood lead level when he was a child. And then likewise on the left hand, you can see they're meeting with Congressman Braley, also from Iowa. This is what Senator Harkin said about the meeting. And this really touched me. This was the letter that Sean sent to Senator Harkin as follow-up to his visit on the Hill. So a very accomplished lobbyist at his young age of 12, Sean has already figured out that you do a thank you note for every visit, and he wrote a terrific one. So let me turn over to Mark Podolski from Cornerstone to give us a little bit of an update on where we stand.
Okay, thanks, Rebecca. So let me just review kind of what we kind of lived through in the past year, and then where we are now going forward and what actions we're taking. So the FY 2012 fiscal year started October 1st a year ago and ended September 30th this past summer. And that's where the program was dropped from a $29 million appropriation in FY 11 to $2 million in FY 12. But the way the program grant cycle works, the grantees largely had funding that continued their work through the summer, and that's when the cuts kind of took place. Just so you have kind of an operational sense of what's been going on. The drop-offs have been occurring rather recently. It has not been a year ago, just because the money cycle is a little bit different than what we call program cycle. So the question is now, with the $2 million federal appropriation, and the Congress has not completed any of the 12 different appropriations bills, including this one that the CDC-led programs funded in, which is the Labor, HHS, and Education bill. They put the entire federal, we call it discretionary budget, which is the money that runs through the appropriations bills, which means not the entitlement programs like Social Security and Medicare, into a continuing resolution. And a continuing resolution is something that is a kind of a stopgap spending measure, or they call it STR. And the one that they've enacted now, they can sometimes run for a matter of days, weeks, months. This one is from October 1st of 2012 through March 27th of 2013. So the notion is that obviously we're going through an election that, the White House, may switch parties, the Senate may switch parties, the House looks like it's going to stay Republican. The betting odds right now are the status quo, Obama reelect potentially, and the Senate stays Democratic, but, that could shift. I mean, we're still, literally 2 weeks out. And, the election outcomes will depend on whether or not they're going to come back and do a lame duck session, meaning that they're going to come back. Lame duck means that you have members who may not be coming back the next year. That could be members of Congress or the president and the vice president. And so there's a period of time from after the election on November 6th through the end of the congressional session, which is probably will wrap up in we call signing die by December 31st, the latest, where there's a period of congressional activity that can't take place, and that involves members, a combination of members who are coming back to work next year and elected members who are not coming back, and that's why they call it a lame duck. And so there is an opportunity for the appropriations process to move forward to completion during that period of time. The congressional staff that work on the Appropriations Committee are working towards that goal right now. It's not the plan of the House or Senate, Republican or Democratic leadership, that they complete, but they have a tentative goal to finish that by November 13th. But if they don't, clearly, just at a staff level again, not this member decision level, to kind of get things ready for members to come back and decide after the election how to go line by line through appropriations bills and decide funding levels. In our case, the only thing we know is last year was $2 million. The Senate raised this program to $10 million. The House number is unknown. They never went to a full committee markup. So we don't really know what the House was planning, but the Senate, as Rebecca said, plans a five-fold increase for this program. Clearly the lobbying activity has paid off, and thanks to all of you who have helped with that, getting our message to Congress that this is a program that needs to be saved and restored back to prior levels of at least, and if not funding, at least programmatic activity, and we'll have to sort through that. But we're in a process now that is a little confusing to the outside world, and whereas it may just stay as is through into the next Congress, which means that they'll come back in January and start working on these appropriations bills for 2013.